Good morning to all at Docplexus. I am Dr. Vaibhav Sethi. I am a practicing vitreoretinal surgeon in Gurgaon, NCR, Delhi, and my basic training was from Arvind Eye Hospital down south, and later on I did my super speciality in retina from the famous LV Prasad Eye Institute, Hyderabad. I'm here to talk about a subject called diabetic retinopathy, in which the eyes start having problem due to diabetes in the body. Diabetic retinopathy, before coming to diabetic retinopathy, I just want to put some emphasis on diabetes, because as everybody will be knowing, and which is very important if some of us don't know, that India is now the diabetic capital of the world, and by 2030 it is estimated that around 75 million of us will be having diabetes. The importance of knowing this is that in a recent study done in India in 2012 did show that half of the diabetics in India are having a poor control of diabetes. So the important part of thing is that the eye is nothing but a mirror to the body. So whatever we can see through the eye, the blood vessels, the hemorrhages, the cotton wool spots, everything will tell us, preempt the diagnosis of having diabetes and what's happening to the other parts of the body due to the disease. So the importance is that around 80 to 90% of people having an eye problem with diabetes do not know that they have an eye problem. So it's basically asymptomatic in them. And if we do a proper screening with an early management and a proper timely treatment for this, it can be life-changing for them, and 95% of severe vision loss can be prevented by this alone. I've been, when I did my training as well as when I'm practicing, we are doing active diabetic retinopathy screening all across, going to remote villages as well as to housing societies, and with a mobile screening van and a proper fundus camera, we are doing rapid mass screening of diabetics all around, and that helps in diagnosing this condition in the eye very early and treating it successfully. I have seen many cases of diabetic retinopathy at my hospital here, and I just want to share experience with you that what I've seen what my experience has been that though the mainstay of treatment for diabetes has been either lasers to the eye, which is in case of proliferative diabetic retinopathy is there, which has been injection in the form of injections, as well as lasers for diabetic macular edema, which is a subset of diabetes affecting the eye in the center of the eye. A lot of patients, a lot of people having diabetes, having diabetic retinopathy changes, as well as having diabetic macular edema, do very well if in the initial month or 2 months, if the diabetes and if we have properly screened them. That means if we have done a thorough checkup in the form of a proper HbA1c level, lipid profile, hemoglobin levels, peripheral smear, and blood pressure screening, and having a proper control of these indices does play a very, very important role in controlling the diabetes in the eye and the severity of diabetic retinopathy. So if we just control these parameters initially for the first month or 2 months, that puts a break to the progress of this disease, and then we can go ahead and treat, unless the patient has come to you, or the patient or the case is already very advanced, in which you have to go ahead and treat for the eyes. So a very important point here is that a thorough systemic control of diabetes is the most important, the most essential thing, along with treatment of the eye. So an ophthalmologist and a physician or an endocrinologist have to work hand in hand to prevent and to treat this problem. So an important point for the physicians, the endocrinologist, and other people who are seeing a recently diagnosed diabetic who is above 40 years of age or having type 2 diabetes, it's very important for them to get their eyes tested as soon as possible that very year. And if the ophthalmologist deemed as necessary, then everything is all right, then an annual checkup is mandatory for them. But for For people having insulin dependent diabetes or type 1 diabetes, they have to get their eye screening done after 5 years of diagnosis of this diabetes. That means it's not very essential initially, but after 5 years, yes, we have to get their eyes tested and regularly screened. So a very important thing is the networking between the ophthalmologist, the endocrinologist and the physician. And Docplexus gives us a very good platform in which we can all connect, show our interesting cases, and not just get opinions from an ophthalmologist per se at the in that platform, but also from other specialties like the physician and nephrologist, endocrinologist. So what is their point of view and how to control the disease in their point of view. So if you're looking at a severe diabetic retinopathy in the eye, that also could mean that the patient could be having a kidney malfunction or could be having a gangrene of the toe or amputated toe due to wet gangrene. So it's basically treating the whole body and not just the eye. That should be the target for the treating doctor. Thank you.